How have breast cancer treatments changed over time? Imagine a time when the only option for breast cancer was a radical surgery that removed the entire breast, chest muscles, and lymph nodes. That was the reality in the late 1800s when William Halsted performed the first radical mastectomy in 1882. This extensive surgery was often disfiguring and required long recovery times, with little involvement from patients in deciding their treatment. For nearly a century, this was the standard approach, despite its physical and emotional toll. As the 20th century progressed, new methods began to emerge. In the early 1900s, radiation therapy started to be used alongside surgery. The discovery of radioactive elements like radium allowed doctors to target cancer cells more precisely, helping to spare some breast tissue and reduce the need for such radical surgeries. Over time, radiation became more refined, making treatments safer and more effective. Chemotherapy also made its debut during this period. Developed from observations during World War II, chemotherapy drugs began to be used in the 1950s and 1960s, initially as an addition to surgery and radiation. By the 1970s, chemotherapy was recognized as a standalone treatment option. The first drug approved for breast cancer was doxorubicin in 1974, which is still used today, although it can cause side effects. Hormonal therapy saw major advances too. Back in 1895, George Beatson showed that removing ovaries could shrink breast tumors, highlighting the role of hormones like estrogen. But it was not until 1977 that the first anti-estrogen drug, tamoxifen, was approved. Tamoxifen works by blocking estrogen receptors and has become a key treatment for estrogen receptor-positive breast cancers, helping to lower the risk of recurrence and death. In recent decades, surgical techniques have become less invasive. Instead of full mastectomies, many women now have breast-conserving surgeries called lumpectomies, often combined with radiation. This approach maintains the breast's appearance while providing the same survival rates. The invention of mammograms in 1969 also played a big role by enabling earlier detection of smaller tumors, which are easier to treat with less invasive methods. Another major breakthrough was the discovery of molecular subtypes of breast cancer. For example, in the 1980s, scientists identified HER2-positive cancers, which tend to be more aggressive. This led to targeted therapies like trastuzumab, also known as Herceptin, which specifically attacks cancer cells overexpressing HER2. These targeted treatments have significantly improved outcomes for patients with this subtype. Today, breast cancer treatment is highly personalized. It combines surgery, radiation, chemotherapy, hormonal therapy, and targeted drugs based on the specific characteristics of the tumor and the patient. This tailored approach aims to maximize effectiveness while minimizing side effects. Ongoing research continues to refine treatment plans, focusing on reducing treatment duration and improving quality of life. In summary, breast cancer treatment has evolved from one-size-fits-all radical surgeries to a sophisticated multidisciplinary approach. Advances in surgery, radiation, chemotherapy, hormonal therapy, and targeted treatments have all contributed to better survival rates and improved quality of life. Always remember, each person's experience is unique, so it is essential to work closely with healthcare professionals to find the best treatment plan for individual needs.